Hey everyone, welcome back. This is the third subpart of the first episode of the series 73 Questions with Healthcare Professionals. The first episode has been with Dr. Uday Bodhankar. So I hope you're excited and have watched the previous episodes. If not, they are linked in the video description, so go and check them out. For now, let's get started. Why do kids love to visit you even when not sick?
Yeah, firstly, they love because I give them Rajgira Laddu. So they say, we want to visit Laddu wale doctor. They don't say Dr. Bodhankar. Then there was a fish part, so they say fish wale doctor.
Oh.
So we are not kept in the marketing, but this is what my practice is, to imbibe good healthy food diet and healthy culture in them since beginning. Thirdly, I think they feel, I'm not saying, they feel that this is a very child-friendly environment and child-friendly doctor. So I ask them, don't come as a sick child, you can come to say me hello on your birthday. So, usually they come to seek my blessings as a child. They come when they go to America, when they are older. So we have got 2 to 3 generation patients.
Wow.
The child which we have seen, we see his child, and sometimes we see their child and a grandchild. So my practice is more than 40 years old. So we see 2 generations, sometimes 3 generations. So
Wow.
I think that makes them keep visiting us.
Multi-generational practice. That's very rare, right? Wow. Now, well, I know this, but what's the special nickname you give to your tiny tots?
Yeah, that is known all over. Like you have seen some child, I was doing tinkling.
Yeah.
I know it is not allowed in America. You can't touch a child. But in India, we got privilege. We can touch the child. We can do tinkling. And then I call Chintu Mintu to the child. If it is a girl, then I call it Chinti Minti. So, sometimes they do to me Chinti Minti. So their parents say, "Arey, why are you doing this?" I said, "No, don't let them do. What I do with them, they play with me." So I call them nickname as Chintu Pintu or Chinky Pinky, something like that. Just they like it also.
True. I remember I used to like it.
Yeah.
It's very friendly, right? Do you have patients that you have treated as children and they later went on to become pediatricians themselves?
Yes, many of them are doctors only, but some of them are in UK, like Dr. Amit, who is one child, his father is also pediatrician, now he is a pediatrician. So many of the children whom are treated, they are not only physicians, but they are pediatricians. Not only that, but they are super specialty in pediatrics.
Wow.
I can remember them, and they come and I feel satisfied, and they also feel that yes, I'm meeting my uncle doctor.
How special. So, being a pediatrician, what's your advice for new parents?
New parents.
Yeah.
Being a pediatrician, my advice to new parents is that since beginning, try to imbibe traditional value, family value, and culture in them, which are religion event, number one. Secondly, I would advise them, because when it is a child less than 3 years, what he tries to imbibe or follow or imitate is what their parents behave. So I would request all of them to follow normal protocol, like avoid screen time. Don't try to watch more TV or mobile in front of children. That's number one. Try to follow yourself healthy diet, so your children will follow same healthy diet. And child also, I will request them to follow some bit exercise, half an hour, so that your child he will follow exercise. And in addition, if you can do yoga, the child will be able to do meditation, yoga since childhood, which will help him to become a very perfect, balanced child in the adulthood.
I love that advice. I wish all doctors, all pediatricians are like that. Wow. How do you soothe or calm a crying child?
See, crying child is very difficult to treat, because usually parents themselves are very much worried and they are frustrated because the child has been crying since night, and they come to us in the morning. In the night, they try to call my hospital to give them medicine. So, at that time, what we do, firstly, my assistant try to see what is the issue. It is a fever, it's abdominal pain, earache, or something like that, some headache, which is causing them usually crying. So we usually don't waste time in examining and taking history. We try to give treatment as per our knowledge, or based on our skill, knowledge, and observation. By giving that, usually the child calms down, not easily, but within 15 minutes. After that, then I examine the child, because examining a crying child is very difficult. You may miss the diagnosis.
Right. Okay, so continuing with the next question. You are a tea, coffee, or soda person?
Actually, I like milk. more so. Because since my childhood, my mother used to give me half cup milk or 1 cup milk, whichever we could afford that time, with sugar or jaggery, and whatever something which was available that time, like cornflakes. Now it is available. It was not available that time. But I would love to have milk first, then to have tea, coffee, or soda, because tea and coffee gets your acidity more. But if you don't have child, then I will go for tea.
How do you make vaccination less scary for kids?
Yeah, very good question. I think I will request all parents. Usually, it has been seen that if the child is breastfeeding, because my nurse gives that, so we ask the mother to breastfeed the child, and at that time, if you give the prick, it is less painful. Other thing that it has been seen that if you give the child some sugar, like honey, even more than some honey or something while giving, that is secondly. Thirdly, you can divert the attention of the child by instrument which are got musical instrument, something like that, or you can make some rhymes, something from mobile, from the child, from the parent side, which you like. At that time, you divert attention, then you can give the break. I think these three things have worked very well. And usually, child has got less pain as compared to not doing this thing. That's what I feel.
Such good suggestions. How do you stay fit?
I think the crux of my stay fit lies from my childhood. As a childhood, we had a very hard life, stressful life. It was not easy life. It was not. We were not having any of the communication, and that is good. Like I don't want to propose myself, but right from Mahal area, which is there, I used to go from here to 8 to 10 kilometers Hadar school in ninth class by walking most of the time, or something like somebody offered me double seat. Then somehow there was no bus. I was not having cycle, lever scooter. So I think the on that time I used to attend gyms. That time 9 I used to do dumbbell, Surya Namaskar, Danda Baitaka, and that time yoga was not there, but doing exercise daily. I think since that time, even till today, what make me fit is regular sleep 6 to 8 hours, healthy diet, exercise like getting up by 7 to 8 p.m. and then walking 20 to 30 minutes, doing yoga, meditation, and exercise. I think these, and keeping you always smiling. I think that is if you're smiling always and trying to help the people and doing, and I will say no curry, no worry, no hurry.
The smile fact is very nice.
Yeah, and of course healthy food. You should have more of salad. You should have more of green leafy vegetable. You should have more dry food and less oily, less spicy, less cheese. Oily should be at least this is advice given to more than 50 years age, or even I will say like from adulthood. If you have got healthy diet, healthy exercise, good, so then you will be healthy and wealthy.
Thank you for that advice, doctor. So we only have a few questions left now, and these are a bit thoughtful. So the next question we have is, what gets you excited to work?
See, in your life, if you want to have to work anywhere, whether it is at home or with your profession, what gets you excited is your mission. My mission is to help the child which are in distress or which are is in problem, irrespective of religion, caste, and economics. Even is poor, I will. So I think the most excitement to me is my work, my mission, my vision. My mission is to help every child who is in distress, and that makes me. I think that gets me excited to work anywhere, India, village, or NGO. I think that is what I will say in short.
A question that is mostly asked to students who are applying to medical school. Why did you choose medicine if you could have done other things to help people?
Naushad, it depends on individual choice. So for me, medicine was the choice because of my illness of my sister,
Yeah,
which I was visiting since I was 5, 10 years old. That way, I think age of me, which was up in 70s and 80s, medicine was the highest honorable noble profession in India, in world, where you are respected, you are valued as a god, you are valued as a noble profession. See, there my answer is that those students who have got their parents are doctors. Previously, it was the practice that those who are doctors, parents, they used to force them, make them doctors, which is not there true nowadays. I will request all my children, even my son Nikhil, Priyanka, let them undergo aptitude test. Aptitude,
Right.
in 10th and 11th. So there, by counseling, you know what is his interest, what is his weaknesses, what is his strength. On that depend, I think, and I think don't force the child to take profession which he doesn't like. I think I will request people that choose according to your aptitude, according to your interest. not what parents say.
This is something most parents probably
Yeah.
need to hear these days
Yeah.
instead of forcing their children. How do you think pediatrics has changed over these years? You have been practicing for
Yeah.
40 years.
Yeah.
How do you think it has changed over?
See, pediatric in our time was mostly based on clinical. We used to listen to the patient history to get the diagnosis of any child or any illness. If you listen to the history properly and take history properly, more than 75 to 80% of diagnosis will come to near normal, near accuracy, I will say. What you need when you are not very perfect about diagnosis from the history, then you need to go with your examination like inspection, palpation, percussion, auscultation.
Right.
There 10% will be added. Now rest of the 10% out of 100, they need investigation like blood investigation, urine examination, CSF examination, then X-ray, and then CT scan and MRI. So I think it is only 10% where you need. So in our time, come to short, pediatric or medicine was based on bedside, like taking history, examination properly, and then coming to diagnosis, then investigation. Over a period now, the people have started forgetting to take because of the lack of time. You can say of lack of training. Usually, they don't take history in detail. I think they change from being a bedside clinician to a investigation-oriented pediatrician. That is the biggest change.
That is such a like
I know.
big change or
Yeah.
big thing that I see now. I was
Yeah.
not like really aware of that,
Yeah.
but that's true with all the developments. Like physicians are more
Yeah.
focused on the investigation. Question 70 we have here.
Huh.
If you could go back in time, would you change any of the experiences that brought you here today?
I joined in medical college as a pediatrician, lecturer in pediatrics. That time it was a very pathetic situation in our medical or Nagpur. There was no, there more of patient, less of beds. So even I was working in postnatal ward, PNC ward we call. There were more than, see, in medical college there were 10 to 12,000 deliveries per year. That time, I'm
Wow.
talking about 81.
That's still a lot.
Yeah, and facility for having these babies admitted if they are sick or they are premature was only 5 to 10 bed. There should have been 50 to 100 bed in nursery for 10,000 deliveries per year. That was a pathetic situation, and there were children and mother lying on the floor bed, which is not supposed to be there because we cannot refuse the admission. As today, we found that many of the standard medical aims they refuse the admission, but we are not supposed to refuse because they're all poor people. Where they will go below? So we used to admit how many patients come. Because 40 beds are there, but patients are 180. So 40 were on the floor bed. I think this situation needs to be changed because of the policy of government should be there to give health infrastructure, health facility to each and every individual, irrespective of economic situation, religion, or age.
I feel for that, really. Medicine is very competitive. What's your advice for aspiring medical students?
Naushad, I will request all aspiring medical students that don't get distressed, don't get disappointed. Definitely, you must aim high or aim on focus on the branch which you like. But suppose you don't get disheartened because that is not the end of your life. Don't try to be very stubborn. Try to be flexible as per the situation.
Right, doctor. Thank you for that. Now, what's your advice for aspiring future pediatricians?
You have to be very empathetic, emotional, and very child friendly in your practice. Number one. Secondly, as far as possible, most of the people will go for general pediatric. Yeah, but my advice to pediatricians that if possible, you can choose some specialty like pediatric neurology, pediatric cardiology, pediatric endocrinology, pediatric gastroenterology, then pediatric growth and development. So there are all specialties are available. If you can go into that branches, not all, few of them who can afford or you can get selected that way better. Otherwise, I think for a pediatrician, my advice is that after your degree, diploma or degree, don't jump into practice. Try to get at least 1 year private practice done in the good consultant in practice because if you jump from for your degree to practice, you make liable to commit mistakes and which are in mistakes are going to a medical legal aspect. Get 6 months to 1 year training under any of the available senior pediatrician.
One last question. If you had the power to change something about medicine and healthcare, what would you change?
Yeah, very good question, Naushad. If I have to change something, if I become something like policymaker, first thing I would like to make all India newborn and child friendly India. That's what I'm because what I have seen in my life is that newborn children are usually not cared properly in our country. Now it is changing, but since I have seen more than 40 years, because newborn are treated as appendix of mother. In the ward also they lie near the mother. They are not treated as indoor patient. So when I was president of IIP 94, I had a discussion with that time health minister. Was very good. I said, sir, unless you allot separate resources, funding, manpower for taking care of the newborn, who will look after them?
Right.
So our mortality of newborn infant was very high because of no facility, no care was done for essential newborn care in India as compared to other countries who are developed countries. So my thing I would like to change is that priority should be given to pregnant women, to girl child. She become pregnant woman, and then newborn child, and then children, and then adolescent. See, adolescent of India or anywhere in the world, they are neglected because they attend 11 to 18 years. See, so what we say as a pediatrician, if child 15 years come, we say, see, it is not our name. You go to medicine. Medicine, you go to pediatric. So the child shifting from pediatric to adult, he remains neglected. So our IAP is very good decision. Since 2010, we have taken the vow that all adult patients, the children, will be taken care of pediatrician. We are up to 12 years allowed. Now we take care up to 18 to 21 years up to adult by pediatrician. So my goal will be to take care, essential newborn care, essential child care, essential adolescent care, and availability of all health infrastructure, which is basically should be available to all the population in India, irrespective of caste, creed, religion, and economic situation. That's what I say.
Wow, thank you for that, doctor, because I personally experienced, the shift, like you're in no man's land when I was, growing in my adolescent years.
Yeah.
So that's a real good thing that you've put into practice. So yes, with that, we are done with the 73 questions. Thank you for being the first guest.
Yeah.
I should apologize because it took a little longer
No,
and we had to see some patients in
Yeah.
between. But before we end this first interview, if you could ask a simple medicine question to our next guest, what would that question be?
The question to this thing is very simple and difficult. What message he will give to the upcoming physician regarding they should become very friendly, they should become very empathetic, and they should be very clinical based oriented than becoming very much commercial oriented. That is what my question to him.
So that's for our next guest. Thank you so much for your
Okay.
valuable time, Dr. Bodhankar. We and I am super grateful.
Thank you.
And it's been an honor. Thank you for having me. Thank you for having us. And yeah, all the best. Have a good day ahead.
Yeah,
thank you so much for having us.
Thank you very much, Naushad. I'm honored to be introduced by no less than my own childhood patient like Naushad, who is now taking higher studies in Caribbean. And I wish you good luck. You will be the best good doctor with full of empathy, sympathy, and mission and vision. I pray Almighty for giving you all this strength. Thank you.
Thank you, doctor. It means a lot, doctor.
Thank you.
Thank you.